segment of Afternoon Live is brought to you by Family Matters.
Health and education, safety, and the quality of life. KATU and our partners are proud to bring you Family Matters, offering solutions to the hard questions.
Because KATU and Providence Health and Services know that family matters.
Thanks for watching Afternoon Live. There are lots of good reasons to know your family history, and perhaps the most important reason comes down to the health of you and your children. Also, knowing your hereditary cancer risk may lead to early detection and even the prevention of certain cancers. So here to share more is Dr. Cassandra Niemi, a gynecologic oncologist at Providence Cancer Institute. Dr. Niemi, really good to have you on to talk about this.
Thanks so much for having me.
You know, you get that question no matter what doctor you go to and whatever you're going in for is what's your family history with cancer? And it's sometimes hard to even know what that is and what you should know. I mean, are we talking about parents, brothers, sisters, aunts, uncles? Share with us kind of what we need to know going into those appointments.
Yeah, that's such a good question. So when we ask you about a family history, we're talking about your first and second degree blood relatives. So folks who are related to you by marriage don't count. We want to know about your parents, your children, brothers and sisters, grandchildren, grandparents, aunts and uncles. Those are your first and second degree relatives. If you happen to know the family history for your cousins, who are your third degree relatives, that's great too.
Are there certain cancers that you really are the triggers for being hereditary that you want to keep your eye on?
I think there are several. I think the simplest way to ask your family about it is just say any cancer. Solid organ cancers, blood cancers, breast and ovarian, colorectal, prostate, and uterine cancers are really heavy hitters here. But I'd encourage you to be broad. Your doctor and your healthcare team can help you sort out which cancers are more linked to genetic risks and which ones aren't.
I can imagine hearing the news or knowing that someone in your family has had cancer, has cancer. There's a little bit of anxiety to that of, okay, what's my risk now?
Absolutely. I think it's important to collect the information and learn what you can about your family member's diagnosis and bring that to your doctor team so they can really figure out and help you assess your own risk. I'd add that it's a complicated thing, and just because there is any cancer history in your family doesn't mean you're at significant risk. Some cancers are more because of environmental things and exposures, and some definitely do run in families. I'd ask you to have your, if you can, the information that'd be helpful would be how old your family member is when they got the cancer diagnosis, and the name of the cancer they had and where it started.
Because does the risk of having one cancer ever lead to another?
It certainly can. We call those hereditary cancer syndromes, and that's for several different types of cancer run in one family. One example would be that there's a link in some people between breast cancer and ovarian cancer and prostate cancer. I think it's important to talk about that link because some of those typically happen in women, some happen in men, but it's important to look at all your relatives to try and assess your risk.
What do you feel about genetic testing and how it plays a role in everything and whether or not you should have it done or not?
I think genetic testing can be incredibly important for some people. Certainly not everybody out there needs to run out and get genetic testing. I'd say collect your family history first, talk to your doctor or your healthcare provider and have them review it. They can kind of pick out the patterns and help you figure out if you might need a further evaluation. And what I mean by that is that if you need to talk to someone who's a genetic counselor whose whole focus is to figure out who needs testing or who should consider it, and they might be able to help you pinpoint, focus in more on whether or not you need actual genetic testing, which is typically a blood test to look for mutations.
We're almost out of time, but really quick, as an oncologist, when you hear this information, when you hear someone tell you, okay, I have the history of this in my family, what do you do with that information? How do you kind of go about what you're going to do for the person?
So we try and pinpoint what their specific risk might be, but once we know that this person might be at increased risk, we talk about things that we can help to either detect cancers early or prevent them entirely. Sometimes that's lifestyle changes, sometimes it's medications, sometimes it's surgery. So I see patients who are at high risk for ovarian cancer. And in those people, taking out the tubes and ovaries at a certain time in life can decrease their risk of cancer by 80%.
Wow.
So, and this varies really based on what kind of cancers you're at risk for. So talk with your healthcare team and get the information that's tailored for you.
Dr. Niemi, thank you so much.
You're so welcome.
And we're going to have more information about today's segment and the Providence Cancer Institute. Just call 503-215-2075, or we'll have information on our website at KATU.com as well. Don't go anywhere. Afternoon Live, we'll be right back.